This is how you fix your knee pain. What you're gonna need first is a foam roller, and we're gonna apply pressure to the hamstrings, to the back of the thigh. And you're going to try to put as much pressure as you can while rolling all the way to the bottom of the butt, all the way up to, or in this case, down to the back of the knee. Very close to the back of the knee. We don't want to get to the back of the knee, but just about 1 or 2 inches from there. Okay, so there are 3 main hamstring muscles. One on the outside, that's fairly large, and then 2 smaller ones. So what we're going to do is we're going to externally rotate our leg, or turn it out, to get that big outside muscle. All you're gonna do is, like I mentioned before, roll it from the top of the knee all the way to the bottom of the butt. Now, if you happen to experience any tightness or pain, what you're gonna do is you're gonna stop right on top of that area. You're gonna continue applying as much pressure as you possibly can, and you're just gonna try to breathe as deeply as you can. Okay, so ideally what you wanna do to apply as much pressure, you wanna lift your butt off the floor. But if you can't do that, you can always press down on top of the thigh so that you can feel a little bit more pressure there. Okay. After about 60 to 90 seconds of breathing, you're gonna notice that it's going to be a little bit less sore and a little bit less tight. So moving on, we're gonna take care of the inside muscles of the hamstring. So here you're gonna turn your body inwards, or in the opposite direction, and turn your leg inwards. From there, we're gonna do the same thing we did for the outside muscle. We're going to roll it down to 1 or 2 inches from the knee, all the way up to the bottom of the butt. And then once again, once you feel a lot of tension or tightness, you're going to stop. You can either apply pressure by lifting your body up, or you can drive your hand down to apply pressure that way. And we're just gonna sit here for about 60 seconds to 90 seconds and breathe deeply all the way down to the core. Great. Once you're done with that, you're obviously gonna check the other side to see if there's any tightness and pain. And now we're gonna move on to the real perpetrators of knee pain, the quadriceps. The quadriceps all do attach to the patella, which can be moved in numerous ways depending on which particular muscle is tight. So we're going to go ahead and troubleshoot which quads are tight with this foam roller. To do that, we're gonna set this on one side of our body. We're gonna take care of one leg at a time. If you have a longer foam roller, you can do both. And it's gonna be better because there's gonna be overall less pressure because there's more surface area. So in this case, all we're gonna do is we're gonna make sure that we are belly down to the floor, and we're gonna do almost of a plank. So for most people who are experiencing a lot of knee pain, these quads are going to be so tight that you're not going to be able to put a lot of pressure on that. So you can use the opposite knee to anchor yourself to the floor to relieve a little bit of tension. So what we're going to do here is we're going to roll the foam roller 1 inch from the knee, very slowly, all the way up to the crease of the hip. That means that you're going to have to crawl back a little bit, but it's all right. So try to keep yourself nice and flat through this entire movement. Once again, you're gonna roll until you find an area that you find a lot of tension. Once you find that spot, we're gonna go ahead and breathe in for about 60 seconds. Now, once you're done with that, don't move because we're not done yet. You're gonna go ahead and scrape. So you're gonna move the leg and drag it on the foam roller to the left and to the right while staying on that particular spot. Now, this is going to definitely send a signal to your brain. It's going to hurt a little bit more, but trust me, it's going to feel much better once we're done. Once you do that 4 or 5 times, we're going to stop and we're going to manipulate the knee joint. So what we're going to do is, while continuing to apply pressure, we're going to go ahead and bend that knee as much as you can. Ideally, try to imagine the heel touching your butt and then extending it back out. We're gonna go ahead and do that 3 to 4 times. Perfect. Once we're finishing up here, we're gonna go ahead and seamlessly hit the other sides of the quad. So to hit the second part of the quad, or the outside of the quad, we're just gonna rotate our body off to the side. I don't want you facing the wall completely, We're not going 90 degrees. We're only going to hit 45 degrees to hit the outside quad muscle. So just like before, we're gonna go ahead and roll all the way up to the crease of the hip, and then all the way back down to about 1 or 2 inches away from the knee. This is usually where most people's tension are. From the many years that I've been training, there have been more people who have had the outside quad muscle be very tight compared to the other ones. So if you feel any overwhelming pain, feel free to take a break, but get back on it and apply as much pressure as you can tolerate. Okay. Once you find that spot, we're just going to repeat the protocol. We're going to hang out, we're going to breathe for about 60 seconds, and then we're going to do the scraping, followed by the joint manipulation. Now, for some people, you might find that there's a few locations where you feel a lot of tension. If this is you, go ahead and try to stop on those particular areas of tension and do the protocol completely on that area. All right, so now that we've handled the middle section of the quads and the outside section of the quads, we're gonna go ahead and take care of the inside section of the quads. For this, we're gonna go ahead and move the foam roller off to the side of the leg that you're gonna work on, and we're gonna lie belly face down onto the floor or on the mat. Okay, I want you to prepare almost like you're about to do some military crawling. And then all you're going to do is lift that bottom leg and place the foam roller about halfway down your thigh. So we're only going to be rolling this foam roller from the middle of the thigh down to about 1 inch from your knee. And to get more pressure out of that, I want you to rotate yourself downwards and pull the leg down as you roll side to side. And just like the other 2 quads, you're going to find the area that has the most tension and tightness. You're going to sit and rest on it for about 60 seconds. Then you're going to drag it. So our legs in a different position. So we're going to drag the leg up and down to get the same results that we did for the other muscles. And once you do that, you're going to go ahead and extend that knee as much as you can, and you'll flex the knee. Beautiful. All right, so now that we've relaxed almost all of the muscles of the quads, you're gonna find that your knee feels a lot better. If you go ahead and stand up, move around, it's 100%, I guarantee that it's gonna feel a lot better. Now, what really causes tightness of the quad muscles, or aka the knee joint, is inability to utilize your glute muscles. So what we're gonna do now, instead of doing a particular quad strengthening exercise, you'll find that a lot of physical therapists will tell you to strengthen your quads. That is not the case. What you need to do is strengthen your glutes. So what we're going to do is we're gonna do a nice glute bridge. Now this is a very common exercise. All you're gonna do is lie down flat, face up, with the feet shoulder width apart. And all you're going to do here is drive your hips upwards as much as you can. And now the most important part that gets left out is you're going to pull both of your feet up towards your body. So it's going to feel like you're pulling your body down towards your feet. So what this does is it actually recruits your hamstring muscles instead of your quad muscles. Because what I tend to find is that when most people do a glute bridge, they also push themselves away from their feet, which is actually turning on their quads, which is the muscle that is responsible for giving you that knee pain and tightness to begin with. So we're going to retrain ourselves to, whenever we use our glutes, to also use a little bit of our hamstrings. And now you're just going to be focusing on the contraction of your glutes and your hamstrings. You can do about 3 sets of this exercise for about a 10 or 15 second hold. What we're trying to achieve here is just a mind-body connection to that area of the body. Now, when it comes to other exercises, like the split squat, for example, this is where I see a lot of people really utilize the wrong parts of the body. When we're going up, a lot of people focus on that very idea of just extending the knees to bring yourself up. And that's going to recruit a lot of quad muscle. What I want you to do instead is focus more on leaning forward or directing the pressure from your glutes. We're actually going to separate the floor forward and backwards to go up. Also, when you do the plank should be more activity from your glutes. Most people, when they do the plank, they focus on extending their knees to keep their butt up in the air. But what I want you to do is, like the glute bridge, extend those hips so that you're utilizing the glute muscles to hold you up instead of those quad muscles. When we look at joint pain, particularly knee tightness and pain, the main cause is always, well, I don't want to say always, the main cause is typically overactivity of the quad muscles. So focusing on learning how to connect with your glutes and your hamstrings will, most of the time, bring that knee tightness down.